Okay, hi, 10. Today we're doing medical treatments. So for this session, we're looking at the medical treatments that were available on the Western Front. So not the medical problems, looking at the treatments that were available. We are going to have this session a little bit different. So it's going to be a little bit more like a lecture. So I'm going to tell you a bunch of information and go through some notes, and then I'm going to tell you what you will be doing in terms of the skills section. So just the same sort of format. Like I said, we are doing medical treatments. We will be looking at two sources, and then you will be writing a pivotal paragraph for one of those sources. So to kind of start us off, I'm going to be talking a little bit about the medical treatments that were available. So what we're looking at on the screen are the 6 medical treatments that we're thinking about. We're looking at there's some numbers on there, but I'm just going to point them out to you. So we're looking at the Carroll-Dakin method. We're looking at Thomas Splint. We're looking at Xrays. We're looking at blood transfusions, plastic surgery, and brain surgery. Now I'm going to go through each one to explain what they actually are. So we're going to start off with the Carroll-Dakin method. And I've put some notes at the bottom there just to kind of summarize, but I am going to also leave this on the screen for you, just so if you want to pause and have a read, this is information that you have in your booklets from last year, but then you can do so. But I'm going to talk you through it. Now, when we think about war, we kind of separate. When we think about medical problems, we think about the physical problems that people have, i.e. artillery fire, shrapnel, bullets, and then we think about the impact those things have, and we think about infection. Now, you have just studied medicine, so hopefully you have a better understanding of infection than when you did when you were in year 9. And really, infection is an incredibly big problem because that can lead to further complications. If you were to, have a wound on a scar or something, the automatic thing that you will do is clean it. And we're wired that way because we know that you need to clean a wound and you need to get rid of any possible material that can cause an infection. Now, at war, this is incredibly difficult. The reason why that is because they're surrounded by mud, potentially in the trenches at the time, say if they're doing something in the regimental aid post. Even if they were to, going to all these other places. So a lot of what we're discussing here happens in the base hospital and some of them in the casualty clearing station. But even when they get there, they're not necessarily in clean clothes. They're not in conditions that they're particularly clean. Mud, dirt, blood, all of those things they have to consider. The reason why is because all of those things can cause infection. They get into your bloodstream, they can cause problems because the bacteria that is carried in can cause further complications. Now, when we think about infection in general, we think about Lister, and we think about all the antiseptic conditions that he developed. We also think of the aseptic conditions of a hospital. The reason why we think of sterilisation and how clean and open a hospital is because of the developments of Lister. Now, at war, this is a lot harder to do. They're unable to create these aseptic operating theatres in the base hospital. The amount of people that are coming in at war just makes it not a viable option. So the development that we're thinking about today is the Carroll-Dakin method. And you can read through this information. But what we're looking at are development from these 2 individuals, so Carroll and Dakin, 2 last names, and the development is a chemical solution flowing through the wound. And the reason why this is a development was because at the beginning of the war, they would try to revert back to those old sort of antiseptic methods to get rid of infection. They would use carbolic acid and hydrogen peroxide to kill the bacteria. But that's not going to stop any new bacteria travelling into the body. Therefore, they created this system in which there's a solution, a constant solution, an irrigation, so constant irrigation of chemical solution. And what this actually does is it stops the infection from happening. As you can see, if a constant solution is fighting infections in your body and fighting that bacteria, then obviously that would mean that it's stopping infection from happening. Now, why was this so important? Well, the reason why it's so important is because in this way you get to reduce amputation. Otherwise, you're having to make sure that another part of the body is not getting infected. Because if it does, you would have to cut it off so that other parts wouldn't be getting infected. But in this way, you are stopping the infection, or you're giving the chemical the chance to fight it. They also made sure that they'd done more obvious things, such as removing the tissue and the dead skin cells around the wound. And that's because that's what's likely, that opened skin cell is likely to have trapped bacteria and dirt. By cutting that away, the dead tissue and the dead skin cells, you're again reducing the risk of infection. Okay, so that's the Carroll-Dakin method. We also have the Thomas Splint. Now, the Thomas Splint is important purely because of the impact it had. Now, 80% of soldiers were shot in the femur, which is the thigh bone, and those people died in that way. Because of the Thomas Splint, that death rate was able to be reduced from 80% to 20%. And the way that it works is, as a splint would, it's the idea that the leg bones are being pulled apart a little so that they're not grinding on each other. Now, the imagery is quite, makes me kind of cringe a little bit because the idea of two bones kind of scratching and grinding on each other. But if you think about it, that's why this was such an important development, because it's able to fix that, further broken bones and blood loss, because a broken bone is pushing against something else by pulling it a little bit to make sure that it's not pressing on something else. And that's the impact of the Thomas Splint. Again, feel free to read through if you feel you'd rather, really know more in depth. But this was so useful that it ended up happening in as close to the front line as possible, in regimental aid posts, in dressing stations, and casualty clearing station. So this is something that was incredibly useful development, as you can see by the death rate. We then also have X-rays. Now, X-rays are kind of obvious why they're so useful. When we're talking about bullets and shrapnel, obviously by using X-rays you're able to see where those fragments are. And by doing that, you're able to get rid of them quickly and reduce the amount of time that it's there and reduce the impact of infection. Now, there were a lot of limitations with early X-rays. Firstly, at the start of the war, while they were able to identify things, they couldn't detect all things in the body. They took a lot of time, so someone who's wounded, who's having an X-ray, would have to sit still for a very long time to kind of find out where things are. The tubes would overheat, and they were incredibly big, and the tubes were fragile. The whole system would overheat, and to kind of combat that, they would rotate them. And those that were static, the ones that weren't able to be rotated, were obviously very, very big. And they're only really, we see developments when we see in 1917 when USA enters the war. We see that the base hospitals are the ones who have the X-rays, but the larger casualty clearing stations also do. And we see the development of mobile X-rays. And while this isn't completely ideal, because it took some time, it did allow things to be closer to the front line, in that they can see things a lot more quickly, therefore remove things, identify the shrapnel and bullets as quick as they can, therefore reducing infection. Again, feel free to pause at the particular sections and have a read if you feel like doing so. Okay, we're also looking at blood transfusions as a treatment. So blood transfusions in 1915 was the method of a donor person and a patient. And this would be literally someone giving their blood from one tube from themselves to the person who needed it. And it's a syringe and it's a tube transfer. And the whole idea of that is you want to stop the shock, because blood loss tend to give you a shock. So if you lose blood, that's when you could potentially get into shock. And the whole direct method was to make sure that wasn't the case. In 1917, we see that blood transfusions start to be used in the casualty clearing station. And that's because of how beneficial it is. But before it's able to become that beneficial, there are developments that happened. Now, those developments are written here, and you can read through them, but I'm just going to talk you through them. So first of all, we have Jeffrey Keynes, who designed the portable blood transfusion kit. And you're going to be looking at a source that actually mentions him. And it's important because he's designed the first portable blood transfusion kit. And the whole point why that's important is because it regulates the blood flow and it prevents clotting. There are issues in that blood needs to be really cold, and there are no refrigeration in the Western Front. So we see some more developments. In 1915, we see this American doctor, Richard Lewison, who develops the idea that if you add sodium citrate to blood, then you don't need to have donor to donor. It could be indirectly with the patient not even in the same room. The whole idea is sodium citrate will allow it to be stored for 2 days. We then see this be even more improved in 1916, where we find out that adding citrate glucose solution allows it to be there for 4 weeks. And it's only because of this where we see that it can be done in the casualty clearing station, and because it's now able to be portable effectively. And here is an example that you can read through in which it is very effective in the Battle of Cambrai, where they use the stored blood to make sure that they are able to save men. Blood transfusions are a very big deal because obviously it's a component in which you need to, and blood loss would have been a major issue at the time. We then have plastic surgery. Now, plastic surgery, at the time, we're not thinking in terms of cosmetics, sort of just desires. We're thinking of people really needing to reconstruct their faces. And we see the use of skin grafts, of using skin from different areas to reconstruct areas that you need, so most typically your face and the head. We see jaw splints and wiring, metal plates and replacement cheeks. We see all these developments, and we have here, well, not particularly there, but Harold Gillies, who was a New Zealand surgeon who's kind of known as the father of plastic surgery. So if you were to hear his name in a source, you would know automatically, okay, plastic surgery. And then lastly, our last treatment is brain surgery. And again, it's something that you're going to be looking at when you look at your sources today. Now, brain surgery is by nature risky. You require a lot of blood to do brain surgery because it's such a particular, very sensitive organ. And you need saline solution to reduce shock. So that's just the context of it. Now, really, the brain surgery would have been so important because of the shrapnel casualties that have come in. Remember, 58% of people were casualties of shrapnel, potentially that being in the brain. And the big development here is we have Harvey Cushing. Now, Harvey Cushing is incredibly important to us because he developed the electromagnet to remove shrapnels lodged in the brain. And he used this, he experimented with this, he used this on the Western Front, and it's proven success. He had, when he operated on people, his survival rate, and it says here, 45 patients, survival rate 71%, compared to the 50% for all brain surgery. And that's because of his use of the electromagnet, and also he used a local anesthetic. And the reason why that's so important is because general anesthetic causes the brain to swell. And he realized this, so he used local anesthetic instead, making it easier to get a piece of, metal out of the brain. So that's just some context of what you'll be doing today. And actually, it's pretty simple if you just remember a little bit from each one. So first thing you have to do is identify the 6 medical treatments, just as you would normally list them. The second thing that you have to do is read through the source. Now, I'm going to let this be a little bit more independent for you, where all I want you to do is read through the source, then make an inference about the treatments that were available. I want you to think about what treatments are they talking about? What are they saying about those treatments? What can you learn? And in the same way, you would write what you can infer and pick an example, pick a quote. You're then going to tell me, why is it useful, the fact that it's Harvey Cushing journal? So we know that source A, after you read this, you'll realize that source A is from Harvey Cushing Surgeon's journal that he published. Why does that make it useful for us? The fact that he's, famous. He's very, very famous for his developments in brain surgery. Why does that make the source more useful for answering an inquiry about treatments on the Western Front? And again, using the same sentence starter, I want to give you more independence with this, so write that answer down. You're then going to be looking at source B. Now, source B is talking about, again, it's what can you learn about treatments that were available for wounded soldiers. So you need to read through and think, well, what treatments are they talking about? Think about who they mention, think about what they're talking about, and then explain to me, well, what does it suggest? What are they actually saying about the treatments available? Once you finish that, you have to do the same thing and explain to me why is the fact that it's Jeffrey Keen's describing development, why is that important? Being an expert in a field, having that experience, why does that make a source more useful? After you've done that, I want you to have a look at the model paragraph. So if we look at source A, source A is useful for an inquiry into treatments available on the Western Front, as it gives an insight into the physical treatments available for the wounded in regard to brain surgery and how the REMC dealt with the infection. For example, the count states, found to my dismay a massive gas infection in the brain. This suggests that while the shrapnel was removed and treatments available did not stop infection from happening, suggesting some ineffective medical care. However, the source is useful in that it explains the method used to reduce this infection. For example, the constant irrigation of the brain suggests that the doctors and the REMC were able to attempt to deal with the infection despite not being able to stop it from happening in the first place, therefore successfully doing brain surgery. The value of the source is increased, remember this is our provenance, because it's from Harvey Cushing's published scientific journal. Harvey Cushing was a notable surgeon who made developments in brain surgery. By being an account from him, it makes the source useful for an inquiry about treatments because he was an expert in his field and would have had an arsenal of research for his findings. He also treated soldiers in battle during the First World War and therefore had a first-hand experience in seeing the effects the treatments had on patients. This is unsurprising given that he was a pioneer in brain surgery. He experimented with the use of electromagnets being used to remove shrapnel fragments lodged in the brain. Shrapnel accounted for 58% of casualties, therefore this could be representative of a common treatment available. Therefore, source A is useful for an inquiry into treatments available, as it showed that brain surgery was plausible to remove shrapnel and executed effectively on the Western Front. Okay, so that's really it. Now, given that I've just given a bit of information about treatments, I do want you to make sure, last time I said it was fine to kind of leave out a bit of knowledge, but I really want you to make sure that you're putting some knowledge based on what I said in the beginning of this video. As usual, follow the red sentence starter and answer the question, how useful is source B for an inquiry into treatments available for soldiers on the Western Front? Make sure you're using the red sentence starter. Make sure that if you're challenging yourself, you're doing 2 inferences, 2 different quotes, making sure that you're keeping to the structure. Content of the source, provenance of the source, and then your teachers will be marking it out of 8 as if you were writing 2 paragraphs. Thank you.